In the last 24 hours, we have tested 172 samples. Out of this number, a total of 84 samples from quarantined guests have been analyzed. We have received confirmation of one person who have tested positive for the coronavirus disease. Apart from those in mandatory quarantine, we have also tested an additional 88 samples of close contacts of the 42 confirmed cases. Out of this number, we have received confirmation of 6 patients who have tested positive for the coronavirus disease, and an additional 1 patient from the Aga Khan Hospital. This now brings the total number of confirmed cases in the last 24 hours to 8. The total number of confirmed cases now stands at 50 in the country. The total number of close contacts that we have so far been monitoring stands at 1,474. Out of this number, 231 have been discharged after completing the mandatory 14-day follow-up period. The 8 cases are now spread out in various counties in the country. Kitui now has 1 case. Nairobi County has 6 new cases, while Mombasa 1. This now puts Nairobi County at 34 cases of those who have so far tested positive, followed by Kilifi at 6, Mombasa at 3, Kajiado and Kwale 1 each, with now the Kitui one. Out of the 44 cases, 26 are male, while 18 are female. From the above data, it is evident that the virus is now being spread through community transmission. This now calls for a lot more personal responsibility among Kenyans in this fight against the disease. Community transmission means that the disease is no longer imported from the outside, but is here with us. We are now spreading it among ourselves. We must now raise our level of alert and intervention measures. To this end, we need to take a number of measures, with the most immediate being in the border transport industry. For now, we need to protect our youth who are in this industry as border riders. And therefore, we will now require that any border rider, to protect himself, must carry only 1 passenger so as to maintain some level of distance. Secondly, the border rider and the passenger must wear masks for protection. We shall be spreading out masks in the counties for this purpose, but irrespective, they must wear, the border rider and the passenger must both wear masks. This is a measure so that that business can continue if it continues to follow the rules. Following the imposition of the curfew in our country, we are now urging the employers to release their employees at 4 p.m. from the workstations. This will enable people to be able to make travel arrangements to their houses before 7 p.m., which is the curfew time. Further, we are giving an advisory that we are encouraging those who stay in Nairobi against traveling up country during this period. Statistics have shown that majority of our elderly people live up country and that they are likely to get exposed, as it happened in Italy, by this kind of movement. Therefore, we would like to urge in the strongest terms possible to urge those who live in Nairobi to stay in Nairobi, those living up country to avoid traveling to Nairobi as much as they can, and when they do, to keep the social and physical distances that we are talking about.
What may work against us, of course, is our weak health system, and of course our disease burden, especially HIV. Especially when we have community transmission as confirmed by Waziri, then especially those who are not adherent to the medicines would have lack of viral suppression, therefore could be at risk. So the youthful population will work to our advantage, but of course our high burden of communicable diseases could disrupt that advantage. This virus is not following a particular trend. Our modeling puts us at having about 1,000 cases by the first week of April, and we postulate that we'll have 5,000 cases by mid-April and potentially 10,000 cases by 30th of April. So those are the figures that we are working with in terms of how we preposition our personal protective equipment, how we preposition our test kits, how we preposition our human resource, and how we preposition our isolation and quarantine facilities. Nature sometimes does not obey science, but we believe if it works along that way, then the actions that we take will be able to pretty be sure that we can be able to be in control. In terms of the testing, we have agreed in consultation with our technical team that we are only going to test those who are in quarantine after the 8th day.
Nimesema hapa watu 50 washaambukizwa, wageni. Sasa ni kusema ya kwamba virusi